that contains the abnormal bilirubin and put in the one that doesn't have that bilirubin. Those are the things you do to avoid those bilirubin from crystallizing out and staying in the brain. That is what gives you cerebral palsy. Do you understand what I'm saying? So at that particular junction, another thing that can actually give us that jaundice much earlier in life is that there's what you call ABO incompatibility. If a woman is blood group O negative or B negative, once the woman is negative and the husband is positive, within 72 hours of delivery, we must give the woman anti-D injection. That one will prevent the next baby from having issue, not from the one you just deliver. Each time we finish delivering baby now and you give the woman anti-D, the anti-D is to protect the next pregnancy, not even the one you deliver is already off. But if by commission or omission you finish delivery, perhaps the woman now have a bilateral tubal ligation, you know she will not deliver again. She actually consented, do permanent family planning. There might be no need to give anti-D. I don't know if you understand. So anything that can prevent jaundice, intrauterine infection. Sometimes a woman might be draining liquor for the past 5 days, 6 days. She will not even come to the hospital. She will be busy draining until that, because the moment the liquor start draining, it means that the protection the baby has been broken. Sometimes when they come to the hospital, they might complain and complain. You only say go to scan. I will try to avoid vaginal examination at that time, because the moment you are examining, the other person will come and examine. You are just pushing infection from down to up. Before you know it, the child will get infected there in the womb. And by the time you deliver the baby will come out with already existing jaundice. Or you just deliver a baby today, the baby is having fever. So those are the things that can. So by the time we reduce infection, by the time we reduce jaundice, as the case may be, then we will reduce kernicterus. And once we reduce kernicterus, cerebral palsy will be reduced. That defect, the problem has already occurred when the baby is as young as 1 week or 2 weeks. The problem has been caused. I don't know if you understand. But what happens is that you will now realize that the baby cannot hold the head at the right time. When other people might be holding their head straight in 3 months, the child might take as much as 6 months before he can hold his head. While others are sitting without support in 6 months, the child might take up to 8 months, 1 year to sit without support. To walk is wahala. They might take as much as 2 years or 3 years to walk. But some aspect of the brain are not affected. Sometimes their intelligence is okay, but the motor function might be defective. They might not be able to walk. That person will go to Nana, Mama, Papa, he can call anything. Gazenije, Okunoka. But it's not as if there is an ongoing insult. The moment that the person now brings the child to the hospital to you at the age of 6 months to tell you now this baby can no longer hold his head at 6 months. At that time, there is nothing medically you can do again, because the insult has occurred while the baby is 2 weeks or 3 weeks. What we are just experiencing that time is the manifestation of the insult, but the insult has happened. But apart from kernicterus and whatnot, there are other few causes. Intrauterine infection can also cause that, but the commonest cause in our environment is that jaundice. And if we can reduce jaundice, then we can reduce cerebral palsy. We can also reduce infection. And most time when the woman comes and she is draining liquor, and you know it's not time to deliver the baby, and you want to buy more time, you start her on antibiotics. I don't know if you understand. Prophylactic antibiotics. You monitor the woman. If the pulse rate suddenly starts going high, if the fetal heart starts going high, there might be intrauterine infection. You might be able to decide to deliver as at that time.